Hi, this is Dr. Rahman, and this is a cautionary tale. I met this woman. She's a 66-year-old black woman who started having abnormal uterine bleeding. When it persisted, she went to the gynecologist and had an evaluation and was diagnosed with a cancer, endometrial cancer. It was recommended that she undergo surgery, hysterectomy, removal of uterus, tubes, and ovaries, with sampling to see if there had been evidence of cancer spread. At that point, the patient declined treatment. She sought a holistic approach. I am not privy to exactly what that holistic approach entailed, but I know that she did not have the surgery. And I also know that the treatment, the holistic treatment, whatever it was, did not solve the problem. In fact, the bleeding continued, the bleeding got heavier, and 2 years later, after 2 years of intermittent, continuous, sometimes heavy bleeding, she passed out. She passed out and was taken to an emergency room, received a blood transfusion, and again the recommendation was made that she should have surgery. This time she consented to surgery, and it was determined based on the pathology that she now had stage 3 uterine cancer. Stage 3 implies that the cancer has spread locally. 6 months later, at that point, it was also recommended that after surgery that she should have chemotherapy and radiation, and the patient declined this. And about 6 months later, there was evidence of cancer spread in her pelvis. The cancer had spread to her rectum. The cancer had spread to small bowel. The cancer had created a fistula, or an opening, between her bowel and her vagina. To correct this, the patient had to undergo surgery to have a colostomy, and at that point began receiving radiation. However, despite the radiation, it was now documented that the cancer had spread to her lungs, and she was started on chemotherapy. While taking chemotherapy, she has since developed blood clots and is now on blood thinner medications. And so here we are, approximately 3 years later, the patient having had to experience everything that she initially wanted to avoid: surgery, radiation, chemotherapy, complications as a result of cancer spread. She's experienced it all. I have to say, this woman is quite a fighter, and she continues to fight for her life. And my message to women is that menopause, the average age of menopause, is 51 years. The usual range that women experience menopause is between 45 and 55. Some women will experience menopause as early as age 40. We define menopause as having gone a year without having a menstrual cycle once you've reached this age. any woman experiencing bleeding after menopause, this is to be considered abnormal. Our friend was in her 60s when she started reporting the abnormal bleeding. Abnormal bleeding needs to be evaluated. Just take that home. Take this message. Abnormal bleeding always needs to be evaluated. Now, the next question is, what do you do about it? This woman opted for holistic treatment. And I am not opposed to people seeking holistic treatment. Just know that if it doesn't appear to be working, you need to seek help elsewhere. If it doesn't appear to be working, you need to seek help elsewhere. Because what we know is it's easier to treat an early discovered cancer versus a cancer which has had time to spread. Each of us gets to live our lives according to our beliefs and our practices and our faith. And no one can say that this woman's choices were wrong. What we can say is we may not have opted to do what she did. We may say that we may have opted to seek treatment earlier than she did, allopathic treatment earlier than she did. We are not here to judge this woman. We are sending her positive prayers for continued strength in fighting what must be a heavy, heavy burden, difficult situation. So let this just be a precautionary tale. It doesn't have to be either or. Maybe holistic and allopathic medicine can find a way to work together. And don't be afraid to seek out help. It's imperative that you seek out help when you need it. Take care.